Welcome to the Misfit Behaviorists podcast. Join your hosts, Audra Jensen and Caitlin Beltran, here to bring you evidence-based strategies with a student-centered focus. Listen weekly for practical and functional advice, along with actionable tips tailored for ABA professionals, special education teachers, and anyone dedicated to supporting students with diverse needs. Ready? Let's get started.
Hey, everybody. Welcome back. We are so excited to be here. I'm Audra Jensen, and I'm here with COVID-stricken Caitlin. How you feeling today?
Hey, it's Caitlin. Hopefully we're not editing out too many sneezes. Otherwise, I'll be fine.
You know, all this time and everybody that I know has had it, I have never had it even once. I mean, I know people have had it like 3 times, and I not even once.
Second time, husband never gets it. So
Really?
He's immune. Yep.
Yeah, we're immune to a lot of things, like, good ideas. I'm immune to that. Healthy, definitely immune to that.
Yeah.
I think so. Anyway, so we're here. We want to talk about some trauma-informed care, some strategies that we've used over the years. A particular case that I had a couple of years ago that was really fun that I was able to see. Trauma-informed care is kind of something new that we've always been aware of being informed about trauma-based situations, but over the last few years, it's become much more in the forefront. And I think I've seen, and Caitlin, you can tell us too, if you've seen a change in the behaviors of students over the course of the last, maybe 5 years. Definitely COVID had an impact on that, but I've definitely seen a lot more students who come in with heavy backpacks on as they come into the classroom already from a background of trauma or just having their own kind of internal trauma that they're dealing with. And I think we're having to change a little bit in how we're addressing those behaviors in the classroom and in home, in our own families as well. And so I want to talk a few minutes about that. What do you think?
Yeah, I think for sure we've definitely seen an increase in trauma that we at least know about, because who's to say, like, is it just more being talked about now? People are sharing it more, or we're more attuned to seeing those things. And then also, a welcome change has been that we're using more trauma-informed strategies. And I know when I first started, this wasn't, the buzzword that it is now, not to say that it's just a buzzword, but this wasn't an approach that we welcomed or embraced or really just knew about. So I'm really glad that we're talking about it, because I think sometimes people are like, oh, that sounds great, I want to do that. What is it? And I think it can mean different things to different people. So I think the example and the visuals you're going to share at the end are great starting points.
Yeah. And I remember even when my son was in ABA, this was 25 years ago, just starting out, some of the practices that we had with him are very different than what we would do here today, 25 years later. And as we grow in a field and we mature and do things better, I think we're all the better for that. And while we had a very good experience with ABA, we definitely would do things differently now. He turned out okay, though. He's a pretty good kid. But 25 years ago, it was much more about, this is the expectation, you do it. It doesn't matter what your background is. What the expectation is what you do. And today we're a lot better about thinking about those backpacks that the students have on, what they're already coming in with. And how can we change the environment? And how can we change our instruction to be better suited to make them successful? And I think that's really important as we think about that. So some common principles that we think about with trauma-informed care are, making sure that all students feel safe and have a place to be, that we're building trust with them. It's important that we build in peer support, which was not something we talked about as much when they were little 25 years ago, having typically developing peers. It's really important to have that. Collaboration with other professionals, with the parents, making sure everybody's on the same team, talking about the same thing, doing the same strategies, and, having their own personal identity issues that we need to be aware of. So things have changed over these 25 years, which I'm very grateful for.
Yeah, to me, I feel like, and I know you're going to talk about this too, but just that element of us putting ourselves in our learners' shoes and seeing things from their perspective every single day was not something that we were taught to constantly be thinking of. It was always the center was around the therapist and getting this student or the learner to do certain skills, which obviously we still want to shape skills, but I don't remember ever being, not ever, but I just feel like the forefront right now, which I love, is constantly thinking, okay, yes, their skill may be here and we need to get them here, but also how are they feeling? Like, are we putting ourselves in their perspective so that we're exploring any possible trauma and like working with that to make sure we're starting at their level?
Yes. And even beyond just trauma informed, just being good responsive therapists and responsive to
Absolutely.
student needs. I remember when it was our very first, we went through a couple of different providers when he was little to find the one that kind of matched us really well, and that's really important if you're a parent thinking about this, that you don't have to take the first person that comes along. You find the person that fits your family. Anyway, we were going through a couple of different people and kind of finding the first feel. And my son also has hyperlexia. So he had an incredibly obsessive need with letters and numbers. And he was focused on that, and he's 2 years old or whatever. He's really little. And then he started to read really early. And we as a family were like, this is a great in to be able to teach him strategies and stuff through the written word that he's really interested in. But he was kind of obsessive about that stuff. And so this particular BCBA, she was great, but she wanted to take all the letters and the books away to focus on the other things because he was so perseverated on it. And it just didn't sit right with us. And so we actually moved to a different BCBA in the same agency who was much more open about using that as a skill. And so she was very responsive to us as a family and what we thought was important. And it worked beautifully. And I think it's important that no matter what we're doing, that this is what we need to be responsive both to the student, to the family dynamic, what's important to them. And so those are just things that I was thinking about too.
Absolutely. And that ties in with just the perspective. Like, imagine if the thing you love to do most in the world and someone just came and snatched your book away that you were reading. I mean, how traumatic could that be? And like the feelings and behaviors that would likely come along with that. So
They did, yes. But we got through it and we were able to use those skills and it was a great experience. So I had this other case a couple of years ago that I want to talk about. It was an interesting case that really got me thinking about being trauma informed and being really receptive to doing things differently depending on what the student's needs were. And this was a cute little kid, man. He was so darling. I think he still is. He's like in middle school now, but I think he was in first grade when we first were called in. He'd had his kindergarten year in kind of the gen ed setting. He had a history of trauma. He had been adopted from a very difficult, so he had some drug abuse background, withdrawal. He had a bunch of abuse things going on. So he had a lot in his backpack. And he was able to make it through that first kindergarten year, but he had a lot of sent homes, a lot of suspensions, a lot of room clears. And by the time they called us in, it was me and an RBT, and they called us in and he was in, I think they'd already placed him. Now remember, this is a few years ago and I'm old and brain doesn't work as well. But they called us in, he was in first grade. He was already placed in the structured learning center, the behavior program, but his behaviors were continuing to escalate really bad. And so they were doing almost daily handholds. I mean, they were doing full on, restraints on him because of safety. He was trying to lope out of the campus. He was ripping down all sorts of stuff in the room. He was having very significant behaviors. And so they called us in to help. And as we started looking at what his needs were and what his background was, I'm sure there are a lot of people aware of Hanley's My Way protocols, which are amazing. I mean, his work has been really good in kind of shaping how we're changing ABA today. But one of the things that he does is this My Way protocol in a clinical and also in a school setting, but it kind of developed in a clinical setting where you can really control the environment, right? And the idea is you give all control back to the student. I mean, you basically give them all the control in a very structured setting, but give them all the control and then very slowly implement demands and providing them a way to access through functional communication, a way to assert what they need, and then we respect it. And it's a very slow and methodical way to build that trust and to build the ability to make progress and to get out of kind of this fix. And this poor kid was in this fix thing. As soon as the demand was placed, he went into immediate shutdown and then escalated almost, it was like guaranteed he would escalate to huge escalations at that point. So we wanted to see what we could do. And this is, again, a few years ago, and they're doing a lot more in schools now. But we thought about, okay, so his SLC program was in a portable that was not cut in half, but the half of it was the SLC program. The other half was like this motor room, sensory room that they used. And so we got permission to kind of take over that sensory room in order to administer this kind of modified My Way protocol. And what we did was we gave him the opportunity, he came in, we wiped the slate clean. We started from scratch. He was very verbal. He has a behavior disorder, but no autism or anything. He has great language. So we were able to sit down and say, hey, we want to try something. And we want to do something really fun with you, because right now it's not fun for you to come to school. And we want to change that. And so we took this room that was right next to him. We kind of set it up all for him. We had all safe equipment in there. So if he did have an escalation, he would be safe. So we had the room and we had safe equipment in there that if he did have an escalation, he would be safe. And we had staff that were all trained in what to do. And we had all of his favorite things in there. So we started with what we called the no demand or the low demand condition. And so what we had him do is he'd come in during the day, the very first part of the day, and we'd have up on the whiteboard a list of a bunch of different things that was kind of his things to do between then and the first break of recess or whatever it was. And at first, the type of things we had up there were like play Minecraft together with the little bricks and stuff, or read a book, one of his favorite books. We'd have all kind of his favorite activities first up there. And we said, okay, I want you, but these are the things we have to get done between now and recess. You get to put them in whatever order you want. And so he would choose which ones, and we would get through, and basically all low demands, fun stuff. And we would do that. And we did that condition for a couple of weeks, and we'd slowly start to add in a couple of lesser preferred things in there, the simpler academic things. It was always the academics that got it good.
So let me just back up for a second. Yeah. Let me ask you a question, because as a BCBA in a public school, I'm like, I love that you are meeting him where he is, explaining everything to him, putting it like shaping to his level. But logistically, how did you get support, or was that difficult, or was that a barrier to get support from the staff and admin and maybe the rest of like the building to kind of buy into this? Because it's pretty different. That it's like a pretty radical approach for a lot of, I would say, public schools today right now.
Yeah, that's a really good question. In this particular case, and other cases will be different, this particular case, they were basically at a we don't know what else to do mode. They were looking at out of district placement. And so we're like, okay, let's do, what can we do now in this setting? We did have that secondary room. They had a different motor room, if I'm remembering right. So we could take access of this one that was right next door. It just was kind of a situation that worked out well in for this situation. I don't think it's possible to do that everywhere.
Sure.
This particular one we had enough staff at the time for it to be basically a one-on-one, and then we had a secondary staff next door in case there was an escalation to step over and help. So it doesn't, I've done it kind of a modified thing with several other kids where, you use part of the classroom that's kind of their setting, and that's just theirs, where you can kind of still manipulate the environment.
What was the criterion for, so you started with almost no demands, and then you kind of eased into a little bit. What were you looking for to progress to that phase?
So that's actually a really great question. So first I want to show you this. This isn't the exact one that we had for him. This is a very similar one that we had. We used a red, yellow, green system where red behaviors were considered unsafe. Yellows were kind of those precursor behaviors. And then green was, fantastic. Anything
Did
else.
he score this, or did you score this?
So we scored it. We did this with all the kids in that class, and I've done with a lot of the class, but in this particular class, we'd do it with them throughout the day. And so they were aware of it. And in this particular case, we were taking very clear data. The subject, the activities were a certain amount of time. So it wasn't like math or something, because we wanted a specific 30-minute interval. So it was very apples to apples as you looked over the course of the day. And so we would track this. Like I said, it wasn't this exact one, but this was just one I pulled up. But we tracked this at the end of the day to see the percentage of greens and yellows and reds. We really paid attention to the greens and the reds. And so this was the first couple of weeks before we started the low demand condition. And these reds are always indicative of significant unsafe behavior, so full escalations.
Wow.
And so you can see as soon as we started this, we saw this drop off. It was not perfect. We still had these little blips. But this is just kind of to show what happened once we pulled that control back in and gave him control, gave him a chance to feel like he had a say in what was going on, to have a positive learning environment.
Then were you able to maintain that low rate of behavior when you moved into the next, inserting more demands?
So yes and no. Demands had to be implemented very slowly. And then it's been a couple of years. I've been off the case for a couple of years, and I know that he still has some issues. So it doesn't fix everything,
Sure.
But initially, this particular staffing, they were in such a crisis mode that to be able to do this, even if it was just a reprieve for a short period of time, it was so beneficial to build that relationship back between them and the student. It did continue to improve, and he was able to spend more time in gen ed. I think he's in middle school now. I think he's in an SLC, but he spends a lot of time in gen ed still. So, it's definitely,
That's awesome.
There's no magic pill. I tell that to my teachers all the time. I'm not going to come in and be able to give you some magic to make it all go away. But this was really good progress. And so we were happy with it.
Right. And we're never looking for perfection. We're looking for progress. And the fact that you were able to show the control of when he was more in control, behaviors significantly decreased and just preserved everyone's safety and well-being. And then we're able to slowly kind of insert functional demands so that he was listening to things and keeping himself safe at the same time. I mean, that's huge progress.
Have you had a case that's been like that? Have you been able to kind of manipulate things in an environment setting like that?
It actually was reminding me of one case that I had years ago, and this was an out-of-district placement. So we were able to really fine-tune every assessment and protocol that we did. But this was a student who was not as verbal, and so he was not able to have that level of conversation with us always, but he had significant behaviors due to not only restricted access to items and activities, like if he was watching the iPad and it was taken away or time to end, a huge behavior would start, but also just we basically made a list. We had to fine tune the functional behavior assessment and the functional analyses we were doing that. We noticed he had behaviors in response to things being taken away, but also just physically hearing the word no, to the point where even if we said, no, it's not raining today, we would often see a behavior. And it took us a while to find that pattern, but he had such a history with this word no. And I guess associating it with, being told no about things. And so kind of same as you're describing, we scaled all the way back and we shaped it to the point where we would give him the iPad, for example, and then take it away and then 1 second and be like, great job relinquishing, in kid-friendly language, like, great job giving it to me for my turn. Here, it's your turn again. At literally 1 second. And then each condition that we had mapped out, we literally slowly and systematically built up to where we got to 5 seconds and then 10 seconds. And then like with most things, I think we saw that it took a long time to go from 1 second of no behaviors to 5 seconds to 10 seconds. But then once he got it, even though he wasn't able to have that conversation with us, we knew he got it from the behaviors dramatically decreasing. And then we really saw the progress soar. And then we did the same thing with tolerating hearing the word no. We would just say, no, it's raining, or, something. We would shout this like exclamatory phrase that was really meaningless, but that triggered him in some way. And then we would reward him or reinforce his lack of behaviors immediately, and then slowly shaped that condition out. So it was, I would say, very successful. Again, a very structured setting, but the fact that we were able to fine tune it, figure out exactly those triggers, and then scale back. So where we were shaping it, I guess kind of using similar techniques to the Hanley approach, where we're looking to just eliminate the behaviors first thing. We're not looking to put anything on extinction. We're going back to that skill building lens. And so that was really successful for us.
6 ways that I think of most important when we're trying to be trauma informed. Now, while we're talking about being trauma informed, these really are strategies that are used with not just students with disabilities or students with behaviors, but typically developing students. These are all strategies that are really helpful for everybody. And some of the things you were talking about made me think about it. Like for this one, building a relationship is, I think, the most important thing that we can do as a teacher with our students, whether those students have a trauma background, have a disability, or are typically developing, building that relationship. So being able, oh my gosh, I can't tell you how much I know of Pokemon and Minecraft that I never thought I would know before. But
You would be
being
my son's favorite person. My son is obsessed with both, and he will be calling you for facts.
excellent. We've lost a little bit of it, but yes, I mean, so when I ran a clinic and I used to do interviews as we were hiring staff, one of the pieces of the interview we'd call the working interview, and we can't really do that in a school setting, but we were able to do that in the clinic. So we would have the regular interview, and then we would schedule a time to do a working interview. And basically the working interview was, there's a kid over there, go play with him. And that was the interview, was watching to see if you're able to get down on the ground and interact with your student, whatever level they're at. It tells you so much about what type of a therapist and a teacher you are, and being able to build that relationship at whatever space that that student is in.
Right. And that's so important that you said that, because, anyone can kind of get right next to the student and start talking to them, but also just being on the lookout for their cues. You'll see a student who's immediately kind of shifting back.
Yeah.
And then so it's not just putting out, but it's also picking up what the learner's putting out and responding to that.
Matching your language with their language ability. A nonverbal, minimally verbal student, you're not all the time, because they're not able to functionally understand and respond to that. So like, use one or two words. That's all you need to do.
Mm-hmm.
And then the other thing really came from, I think it was floor time and PIR, that came from their ability was really amazing in being able to teach their people to get down there. If you have a student that is in self-stimulatory behavior, you can engage with the student. Make yourself the most reinforcing thing around the student. So having the most important things to the student with you. If they're doing something, you can do it with them. You're going to find you're going to be able to open up their ability to interact with you as you're doing something that's important to them, whatever it is. I mean, I have spun in circles and played with ribbons and done all sorts of silly things, because that's what the student was responding to. So it's great. So number 2, I would say, is be consistent. So in a school setting, in a therapy setting, in a home setting, I mean, I'm sure everybody out there, almost everybody is a parent, and you know how important it is to have consistent boundaries and expectations. There's not just because we want to impose rules on the students, it's because it gives them a sense of safety. They know that if they do this, this, or this, then this happens. And that gives them that sense of safety that they're seeking. The third thing I was thinking is, and this is a big one, giving choices for anything you can think about, so the student feels that they have control. Choices can be as simple as, instead of saying, it's time to sit a circle, say, do you want to sit in the blue chair or the red chair? Do you want to, we're doing math now. Do you want to use a crayon or a marker? It's like giving them.
I can't tell you how many times I've recommended this just as like a simple proactive strategy. And, sometimes you'll get the question like, well, it's not a choice to do math. But it's like, it can be a choice, right? And we used to call them like artificial choices, exactly like you just mentioned. Do you want to use a pen or a pencil? Do you want to sit next to me or do it yourself? And it's amazing how sometimes you'll see that anxiety decrease like immediately on the learner when it's not just like sit down, do math. Right. And I use that all the time in my own household with my son, just with simple, learning to respond to routines in the household types of things, like, put your snack away. It's never coming naturally to me to just say, do it now because I said so. That's just not my personality. So if I notice something's laying around, I might say like, okay, before bedtime, that's going to be put away. You can do it whenever. If it's not important, if it's important and it's in someone's way, then that's different. And that goes back to being consistent, I think, like you said.
Right. In fact, there was one of our listeners reached out last week, I think, and said, can you talk about the difference between imperative and declarative language? And I think that's something we should really do a podcast on soon, because that fits right into this. And to be able to use, and the difference between imperative and declarative, being able to, the difference between saying, do this, as opposed to saying, it looks like our friends are ... It pulls so much of that anxiety and stuff away from the student who maybe has a history of not getting the right answer and having a reaction at home or at school, whatever. So that is something I think we should talk about soon, is imperative and declarative language would be really good.
For sure.
Number 3, pick your battles. I have a friend I'm going to bring onto the podcast in a few weeks who has a really good story of something that happened. It's a really good example of this in picking battles of things that are not important and things that are important. And then I know I've always taught my staff that to think of it like a frame of a picture. So consider the things around the frame as things that are non-negotiable. Brushing your teeth is not negotiable. You got to brush your teeth. But everything in the middle is fluid. So if you want to brush your teeth sitting on the toilet, if you want to sit in the bathtub and brush your teeth, I don't care. If you want to do it in the shower, that's fine too. So anything you want to use this brush, this toothbrush, don't use the toilet brush. That is a non-negotiable. So, you have these sort of things that are around the frame that are non-negotiable. Everything else, be able to say that is okay. So you have a student, I understand that you have 30 students in a class. It's harder to do, but you're able to do it in smaller things. But if a student wants to sit on the floor to do their math, is it really that important to make them sit in the chair? So just think about what kind of the end goal is. Is the goal to do math or is the goal to sit in the chair?
I love that picture frame analogy, because I think sometimes when you say, or anyone says, pick your battles, it can be misinterpreted. And so just using the brush teeth example, it's like, well, I told him to brush his teeth and he said no. So I didn't want to pick the battle. So I moved on to something else. And having it like, yes, pick your battles, but you have to know which battles you're picking first. You can't decide in the middle. Oh, you know what? I kind of made the expectation clear this was non-negotiable, but then I'm just going to back down. That's not consistent for the learner. So pick your battles, but know which battles you're picking and which ones are non-negotiable and what's fluid and what's not, kind of from the start.
And we know our students, we know our kids, we can predict pretty reliably what's going to trigger things. Maybe if it's a new student, it's a little bit harder, but for the most part, we know. And to just think ahead and plan ahead for them. And that just gives them, again, that sense of safety in having things already figured out beforehand. That reactive stuff that we do, we all do it. We do it as parents, we do it as teachers. We're reactive too, especially when you're dealing with challenging behavior and there's, a big behavior. It's really hard not to get reactive, to not get that emotional response, to just take a breath and to go, okay, we planned for this. What is the plan? Let's go from there.
Right.
All right. And then this one I think is really important, just starting fresh. I talk a lot about the crisis mountain where, you have a student who kind of escalates and then kind of makes their way back down. They're never going to be kind of in a perfectly calm setting once they've had an escalation. But once we're done, and that whether it's the next day or the next hour, whenever they're ready to re-engage, that's it. We don't need to harp on it.
Absolutely. There's no such thing as just nothing to be gained from just stewing or living in that behavior for the rest of the day.
And to not take it personally. I've seen staff, it's hard not to, but not to take some of the behaviors that we experience and we're part of, especially when they're attacking us, physically attacking us. It's hard to not take some of that stuff personally, but to remember this is a student who has a backpack on, and to remember that it's not their fault that they're exhibiting this behavior, and it's okay. So just kind of stepping back, and this is just, this thing is happening over here and I'm a part of it, but it's not on me.
Where can people find that visual, Audra?
So I just made that visual for our little podcast today, but I am going to link, I made some FBA visuals, kind of behavior plan visuals, and I'll add it into that. And I'm going to share that with everybody. So let me show you. So these behavior plan strategies that are really helpful, but the thing I really want to share with everybody is this mountain. I like this as a visual, just in thinking about our students and a mountain that they're surpassing, they're climbing over when they're having these crises, in realizing that they're in a ready state to learn when they're down here. Once they're having that anxiety and that kind of non-compliance that we observe, and then an unsafe, if we're having a full escalation, no learning is happening up here anyway. And then it takes time for them to come down the mountain. This is not a quick fix. This takes time for a student to recover, and for us to be mindful that It does take time for them to go through the process, and we need to give them that space and time in order to do that. And I think it's important that we give them enough to do that. So I will link this whole thing for everybody into the show notes, and I'll add the visual that I made today as well. So yeah, don't forget to comment if you like them. We'd love to hear from you as we're thinking about upcoming episodes that we're going to be doing. Like I said, we'd like to hear what you want to talk about. And if you join the Facebook group, the Misfit Behaviorists Facebook group, we're going to be talking about each of these episodes and having kind of extended learning. We'd love to have you a part of it there.
And don't forget to follow us on Apple Podcasts so that you don't miss an episode, or you can subscribe on our YouTube channel so that you can see all of these awesome visuals as we go along.
Thank you, everybody, and we will see you next time.
See you next time.
Thanks for listening to the Misfit Behaviorists, and be sure to tune in next week for more tips and tricks. Don't forget to subscribe so you don't miss an episode.